2024, beginning of our budget hearings for the Douglas County Commission. We will have start today with an overview from staff. At 9:30, we will talk with emergency services partners and divisions. At 10:30, we will talk about our justice system, and 11:30, land records and taxation. So we will have a full meeting today and for the next many days until we finish this. Just as a reminder, we don't take public comment during our budget hearings. We will take public comment during our regular Wednesday business meeting at 5:30 if anyone would care to join us and have questions or comments at that time. We also make no decisions during these budget hearings. This is just for our chance to ask questions and from what we've been working through on our budget books. So I will turn it over to Sarah to give us an overview.
Thank you, commissioners. I'm going to share my screen here. Doodly-doo. It's my pleasure to bring you the proposed 2025 operating budget for Douglas County. Before we start, I want to thank a team of staff that have really worked very, very hard to bring this book and this whole budget together. It is a $200 million budget, so it is a lot of work and it is a lot of, it's definitely a team effort. Cami Owens, our budget manager, is key to this process to make sure not only do we have all of our funds balanced, but also that our tax roll and our tax levies are set, and she works closely with the clerk's office on that. I want to thank Brooke Sauer, our finance manager, who's been really key in some of the use of our financial system and tying this into and some of our reporting that we use. Jake Broadbent behind me has been super helpful in how we have changed working with our community partners and the online submittals that they did this year, and that none of that would be possible without Soji Sitwala from Information Technology, who is in the back, who has just literally transformed how this whole process came together in ways I just did not think was possible to do in a year. I think it means I'm old and I am still used to doing this on Excel. So I'm just, and then in addition to Katie Fitzgerald, Bob Tryansky, and Jill Jolliker, really have been vital into reviewing supplemental requests and base budgets from departments. So really want to thank this team that brought all this together and listen to me when I get very nervous and worried that things aren't where they're supposed to be. So I appreciate their patience with me. All right, so we're going to jump into the overview. This is a 10-year assessed valuation growth history chart. You know, when I came to Douglas County in 2011, and 3 to 4% assessed valuation growth was our norm. That's what we sort of expected. When you look at the last 5 years, there's been such volatility in that place. I'm not really sure what our new normal will be on the other side of this. I definitely don't think it'll be double-digit growth like we saw in 22 and 23, but I'm not sure based off of how housing affordability is going in this community that we're ever going to be back down to 3 to 4% again. I think it's just something we're going to have to see as this process goes through. And commissioners, just jump in if you want to stop me or you have any questions. Sales tax revenues, sales tax is roughly 10% of our general fund-ish, right, Kimmy? And so I don't watch it. I do watch it, but I don't budget it so tightly as the city would, because where it is a more significant part of their revenue stream. We try to be conservative on our sales tax projections because they are, they do vary quite a bit from month to month. In your books, you have a detailed, I think it's about a 5-year history of every sales tax revenues we've received by month. So, take a look at that if you want to see what we're seeing in terms of the volatility of where it goes. I have included in the general fund, which receives all the sales tax dollars, 9.5 million. Our revenues last year were 9.6. I don't want to try to project above 9.6 just because I want to be pretty confident that we're going to receive those before we would extend ourselves into a place where I'm not quite sure what the growth rate will be. We've talked about mortgage registration rates for a long time around here. We really think those have hit rock bottom in terms of the changes the state made on how much mortgage registration fees will be collected. And then also just with interest rates going up, the Register of Deeds office is not seeing the amount of home sales and the refinancing that leads to some of those fees. So I think we think, and the Register of Deeds will be here later today and he can talk about those. The next one, also interest income. Our treasurer, Adam Rains, will be here as well and can talk about interest income that we have seen quite a bit of growth in that in terms of what we've budgeted. I also think we've been pretty conservative in what we've budgeted on that revenue number too. So I think we should be in pretty good shape. These are our mill levied funds. So there's a lot of conversation these days about budgeted funds, non-budgeted funds, mill levy funds, non-mill levy funds. So I want to kind of clarify that. Budgeted funds is a term defined by the state. Every fund Douglas County has is budgeted and is shown to the public. So just because it's not budgeted, that's how the state defines budget. It is not how we define budget here in terms of what in that book, you have every fund the county has. So what we're showing you here are funds that get mill levy or could get mill levy, but there's a disclaimer for that. We show the bond and interest fund. The bond and interest fund is allowed to have mill levy support. Our bond and interest fund does not have mill levy support. When I got here 13 years ago, this fund was used to process special assessments. So the big one that is the biggest one in it right now is the Yankee Tank watershed improvement, where property owners around that are paying into it to pay off the bonds that were let to improve Yankee Tank. There is no property tax dollars that go to that. I can't eliminate that fund without not paying off those bonds. So, but it receives no mill levy support. The other two funds, the general fund, the employee benefits fund, and the road and bridge fund do receive mill levy support. And I consider those our major operating funds. And our value of a mill for Douglas County, which is really based off of the total assessed valuation. It's not based off our budget or how big our budget is. It's based off of how much value we have in Douglas County, is just over 2 mills. 2 million, yes, mills and millions, we use interchangeable. We shouldn't, but we do. So the 2025 budget has a flat mill levy of 44.208 mill levy, and we've calculated that based off of some assessed values of different properties and the taxes that are paid.
Sarah, can I just back?
Yep.
Just to give clarification to folks who are new to the process, the flat mill levy is the staff-based budget. It's the administration budget that is given to us, and from there we get to add or subtract as we want to come up with the final budget. Correct.
Yes, my direction from the county commission is to prepare a flat mill levy budget and provide options for both supplemental requests that our community partners and departments have included, and then also options that if the commissioners want to roll back, we can. Roll the mill levy back. Okay. Fund balance by fund. This is a chart that's straight out of your budget book. It's hard to see for those of you that might be out there. So if you want a copy, I can get you a copy from the budget book. But I wanted to put the whole chart up here because we've had a lot of conversation about fund balance. And I wanted to show everyone kind of where that this is public information, is budgeted, it's on our website, it is included for the public, and these are all of our funds. Our general fund is our largest fund, our largest operating fund, and we worked pretty hard this year to keep the general fund balance on target to where we saw it actually a little less than the year before is where we think we will be able to start 2026 in, at 19.2%. So yeah, I'll just kind of summarize it. I'm not gonna read every column. The Road and Bridge Fund is a separate fund that is, it's segregated because it receives special city county highway tax funds, which is gas tax funds from the state. So most of Public Works operation is in there, not all of their operations. Their fund balance totals do go a little bit above what our fund balance policy is for operating funds. We figured this out just as we were putting together the last stages of the proposed budget. We've talked to Public Works. Their recommendation would be to transfer roughly $500,000. That's all it would be to get this fund balance back into target. And they would prefer it to go to CIP, our Capital Improvement Plan Fund. So I think if that's something commissioners would like to do to make sure that we keep that fund balance target where we have it according to policy, that we would prepare the final budget to have an additional transfer to CIP. I think we can do it straight from Road and Bridge, can't we? Yeah. Okay. So the Employee Benefits Fund, we're going to talk more about the Employee Benefits Fund later. Douglas County has always budgeted benefits separately for the whole organization. It's not budgeted in departments. We are self-insured for our health insurance. So this fund is also where we place our employer portion of funds so that we can pay for health insurance benefits. Its fund balance is above our 25% target. And we're going to talk more later about, we are purposely trying to spend this fund down, but I want to talk about that a little bit later. So if we could hold off on that. As you can see, commissioners, we eliminated a couple funds. We consolidated them within the general fund. Special liability was one of those last year. Special Parks and Recreation Fund is a separate fund that is created with proceeds from alcohol tax sales. And it can only be spent on parks and recreation equipment. Generally, we let a fund balance sort of accumulate in this fund, and then Public Works brings us a project for county parks, and then we spend it. So it is not subject to our fund balance policy because it is not an operating fund. Same goes with our special alcohol program. As you can see, it's a very small fund balance in there. So it is above our fund balance target, but it also we save money in those funds, and then we make larger installments to our alcohol substance abuse providers in our community. The next fund, 227, is our new fund from the municipalities fight addiction. This is where opioid proceeds go. We had some conversation. Jake prepared some information for you earlier this year. We put that in the memos, didn't we? Okay, we're going to give you some additional information on the Municipal Fights Addiction Fund. Fund 235 is our 911 fees fund. So that it receives direct funds that you pay on your cell phone and your landline phone to pay for 911 services. It is a little above our target, but and Tony's here, we're getting ready to renegotiate our agreement with Motorola. I didn't want to make a lot of changes to this fund until we had some of those conversations. We fully anticipate we're going to need everything in this fund and then some to pay for that new Motorola contract. I think we will probably have to move some of those expenses back to the general fund, and that I don't think that this fund will be able to pay that whole contract. Motor vehicle operation is where we put fees for that we receive from processing motor vehicles. This is supposed to pay for everything done at motor vehicle. It does not. Those fees do not cover the costs of processing car tags and taxes on behalf of the state. We had to move some additional funds out of this fund and into the general fund. As you see, we're over the target, but it's not enough to support the positions ongoing. So I think we can talk through some of those things, but ultimately, I mean, it's a pretty small fund, and we're struggling to sort of be able to use those fees. We have done some fee increases, so I'd kind of like to give it some time to see where it goes, and then maybe we can have more conversation. Bond and interest we talked about before. It's all the funds that are in that fund are specifically collected to pay off specific debts and are really special assessments. The local county sales tax fund is where we take half of our sales tax proceeds and we put them in this fund to pay for capital projects. Commissioners, this is where we are transferring funds to prepare for the renovation of the Judicial and Law Enforcement Center and the emergency services building that will be out here by the jail. We have accumulated quite a bit of cash into this fund, and it will be used to help make sure that we can pay for that large project without any sort of tax increase for the community. So counties have a really limited ability to issue debt, so I have to be really cautious about projects that need debt, and this fund, sales tax funds, are really the only funds that can do to support that for the county. And so this is where we would be paying for that project. So the cash balance in that fund would be used as a cash payment against the debt. And then we would also issue some debt to help cover that. The behavioral health sales tax is the last fund. This covers both the operations for behavioral health services and also the debt service on the treatment and recovery center. It is also above our target. We've had some conversations about what is available above that fund balance target. We've recommended some projects in the proposed budget to help spend down that capital to put more supportive housing in our community, and we're real excited about those projects. And then letting the community know that we have funds available to help support supportive housing. I was trying to think of not using support twice in
So
one
Sarah,
sentence. Go ahead.
also within that fund, so it's the quarter-cent sales tax, but we also put general fund towards that for some of those projects also. So that's part of why that fund is so
Correct.
large.
Yes, there's over $5 million of transfers from the general fund, so ad valorem dollars that are transferred into that fund to support, and those were for projects that were supported by behavioral health, like Burt Nash's base funding was before the behavioral health sales tax came in place. So there's, I think that transfer is about $5 million. Okay, so when Employee Benefits Fund, I said we were going to talk about the Employee Benefits Fund. We've known that our fund balances were above target for a period of time. And so one of the things that we really wanted to do this year was to talk about how do we get the Employee Benefits Fund back in line with our fund balance targets. So we talked about two different options, and I'm going to go to the next slide because I don't know, for me, it's a little easier than this, but this has got some good narrative as to what we tried to do. So, when you're trying to reduce fund balance, but you want to do it in a sustainable way, and you're trying to lower the mill levy support in a fund, it takes some work to sort of make sure that we wanted to get where we wanted to do it. So, but we didn't cut too much so that there wasn't, so that the fund was unsustainable in the future. So we talked about a 2 mil cut out of this fund and a 4 mil cut out of that fund. If both of a 2 mil reduction and a 4 mil reduction in this fund we could do that for 2025. The problem was 2026. And I wanted to be sure that we had enough mill levy support so that in a year from now, I wasn't asking the county commission to raise taxes to help support that fund. So we talked about a 2 mil reduction and a 4 mil reduction. Remember, 2 mils is 4 million, 4 mils is 8 million. So when we cut 4 mils, which is what we tried first, it would have left us in 2026 with a 15% fund balance. I was uncomfortable with that low of a fund balance, given that our employees and their benefits that they count on are paid for out of this fund. So we ended up doing a 2 mil reduction out of that fund. And what we did there is we moved it to the general fund. So we have a proposed flat mill levy, but I took those 2 mils and I moved them to the general fund. So they are available in the general fund for commissioners to reallocate for additional requests or to use for a mill levy reduction. And so this was actually the worksheet that we worked through that shows, and that's kind of what I wanted to show you. So I want to call your attention to the ad valorem tax line. I believe, because I love words and where they come from, I've always learned that I thought ad valorem means of value, or is it of land? Someone who knows Latin, I want to find it, but so in all of our documentation, we talk about property taxes ad valorem. So you see in 2023, our ad valorem tax for this fund was 14.6 million. In 2024, our budget is 14.5. So for 2025, this is what would happen when we did the 4 mil reduction. You would lower your ad valorem tax in that fund almost in half. And then if you follow that down through the expenses, and then you look at what happens at the ending fund balance of 2026, you see that we have $1.5 million, which is below our fund balance targets for that fund. So I just kind of wanted, because I think sometimes it's a little hard to describe like how if you're reducing your ongoing expenses, what its impact would be on fund balance. Does that make sense? Okay, great.
So we looked at a 4 mil reduction and a 2 mil reduction. Was there, splitting the difference, was there a 3 mil reduction or?
I didn't look at a 3 mil,
Okay.
but it's something that if commissioners want us to do, we could do if you want us to. We just, I don't know, liked even numbers and played with 2 and 4. Transfers. It's very common in local government to have transfers between funds. And so, but I want to walk through them because sometimes a lot of people are like, what is a transfer and what is it going for? So want to put some just clarity around that. We transfer funds from the general fund to our ambulance reserve fund. So this is our equipment replacement fund to buy ambulances for our partnership with Lawrence Douglas County Fire and Medical. Ambulances are really expensive. So we're trying to bolster this fund so that we can support 3 ambulance purchases a year. So 1.7 million is proposed to be transferred into that fund to support ambulance replacement. Our CIP, our Capital Improvement Plan fund, is cash funded in Douglas County. It is not supported by debt. We are pay-as-you-go organization for our CIP. $5.4 million is proposed. That is a 5% increase over the year before into that fund. That fund covers road and bridge projects in the unincorporated area and county facilities. Equipment reserve fund. So this is multiple general fund departments all have equipment reserve funds where they used to buy cars, vehicles, equipment, computer equipment. All kinds of things are allowed by statute to be purchased out of this fund. And really that fund is allowed to, it's allowed to maintain higher balances because it's in essence your savings account to pay for future equipment purchases. So all of those out of the general fund together, it's about 1.3. Sales tax fund, commissioners, as you know, we take half of the proceeds from the 1 cent sales tax and we move it into the sales tax fund. So that 4.75 represents that half of that sales tax amount that is going into the sales tax fund that will be used to support debt and cash financing for the judicial and law enforcement center improvements. We transfer, as we talked about earlier, $5.4 million of general fund dollars from the general fund into the behavioral health sales tax fund. And then our work comp fund, workers' compensation fund, we transfer funds into that account to support our liabilities for workers' compensation. We are self-insured for workers' compensation as well.
Just a quick question on the equipment reserve fund. Most of our departments put something in for their own equipment reserve, but not all of them do. Are we going to be moving to where everyone who is expecting to need a vehicle sometime in the future is paying into that fund, planning ahead?
I think we are now at the stage where everybody who has their own equipment has their own fund.
Okay.
But remember, like the clerk has one also for voting machines, so it's not always just vehicles. It's a lot of different types of equipment.
Thanks.
I think we're there on everybody, Cammie. Pretty close. Supplemental requests that were funded. So we go through a process where when we ask both departments and outside agencies to prepare us a base budget, and then if they want any funding above what they received the year before, they submit a supplemental request. Commissioners, you have copies of all of those supplemental requests in your budget book. And these are ones that I included as funded in my proposed budget. The first two are related to LDCFM, the ambulance replacement program that we talked about, and the Station 6 and 7 expansion. I've been having a number of conversations with the City of Lawrence and the city manager and staff at LDCFM about the expansion. Commissioners, you had a joint meeting with the Lawrence City Commission last year on the station expansion project. My understanding is the city manager is looking to include the expansion in his 2025 budget. In the spirit of our joint governance agreement, I included that as well. So that represents about $900,000 of additional funding towards those two towards that expansion, but really most of that 900,000 was related to work the city did after we closed our budget last year, and they added additional staff. So there's really no staff expansion in this, but this does not show reductions. It has some restoration. You have some material on what that is. We have also included one-time capital dollars for the county's portion of what would be needed to begin building Station 6 and 7. We've included funding for our market and merit pool and our compensation study that commissioners heard about a week or two ago related to getting our wages market competitive. Commissioners, I included a one-time $150,000 for an evaluation of the specialty courts. You had a presentation on that a couple weeks back. I've included a finance analyst position. Commissioners, we've had a lot of conversation about our small but mighty team when it comes to finance and how our amount of federal awards have dramatically increased. And so I really feel like as we think about implementing a new financial business system in 25 and 26, we're going to need additional staff on board to help manage that. Emergency Communication Center priority emergency fire protocols. This was recommended by our first response partners and was included in the budget. I've included a IT technical engineer and half of a year of a position for buildings and grounds related to the Judicial and Law Enforcement Center expansion. So that's a position that would start in July and would be on board to help as that building was built, understand those systems, and then help us maintain that building. We've added a number of square footage in our footprint over the last couple of years, and we've not added any staff for maintenance since the fairgrounds expansion, which was over 10 years ago. So I think it's time for them to have an additional position. Public Works, the fleet mechanic, the fleet division is in the general fund. It's not in the road and bridge fund. They asked for a fleet mechanic last year. The number of vehicles that they are managing has increased substantially between Consolidated Fire District 1 and the Sheriff's Office. So this will help us maintain those vehicles. Reentry clerk position for the sheriff. And then the last one is the landlord incentive program. We have funded this in the past. So it's the only non-capital community partner request I included in my proposed budget. The rest are for the commissioners to consider. I included it because we have traditionally funded it. They did not ask for it in 2024, so we didn't fund it. They do want it in 2025. I think they use these funds over a period of like 2 years for landlord incentives for housing supports. So we can talk to the housing authority about trying to get a more stable number, so I don't have a $50,000 add and a $50,000 decrease. The rest of these talk about some additional increase in the behavioral health sales tax fund. The first would be capital funds one time to support purchasing a family shelter that would be operated by the City of Lawrence. So this is an estimate of what the capital would be. So our partnership in this process would be to buy the shelter. We have included funding for a flexible housing subsidy pool. This would be a locally supported supportive housing subsidy program. We have a lot of work to do to flesh out what that program would be like, but this was called for in a place for everyone. Our plan to end chronic homelessness in Lawrence and Douglas County. And Jill has been doing a ton of work on this, and I think would be really excited to talk to the commissioners more about this program. DECA, Supportive Housing Capital. This was a project that was included in the original outline of funds to be used for when we went for the sales tax. We believe they're going to be ready to do that. Oh, am I all on time? I better wrap up. Okay, I'm going to keep moving. And then some additional support for Mirror Incorporated for substance abuse, clinical services, capital for both 9th Street Missionary Baptist and for their project, and the Cardinal Housing, or the Cardinal Networks for their substance use housing capital project. So this is our timeline, commissioners. We're going to meet the next 3 days with hearings from our community partners and departments. And then I have 4 days set aside for deliberations. We can talk later about if we want to, how we want to do those deliberations. We have a statutory deadline to notify the county clerk of our intent to exceed the revenue neutral rate by July 20th. August 7th is when we're going to come back and do a review of our capital improvement plan and Consolidated Fire District 1. And then the R&R notices are sent out by the county clerk. We have to publish those hearing notices and our budget in the paper in advance, 10 days in advance of our public hearing, which we are planning to have happen on August 28th. Commissioners, do you have any questions for me before we call our emergency service friends up?
So I don't need an answer on this right away, but in the past, we've talked about our level of comfort with one-time funds from fund balance. Do you have any thoughts on that, Sarah, you want to share?
Yeah, I think obviously in the behavioral health sales tax fund, and we can get you the exact dollar amount, but I think as staff, we think there's approximately $12 million available in that fund to support one-time projects, but they have to be projects that are eligible for use for behavioral health. So there's that. I think we also have ability in the general fund to support projects, other one-time funding projects. As the commissioners know, I'm pretty conservative in my revenue estimates. So even at that 19%, I anticipate we're going to end the year in a positive financial position. So we have the ability to support one-time projects from that general fund. I haven't worked up a specific dollar amount in the general fund. And then also if it's eligible for capital, it's something that could be paid for out of the CIP as well.
One last question from me. You noted the adjustment to pay plan at $3 million. And then as I went through each one of the county budgets, adjustment to pay is in there as well.
Yeah.
Is that in addition? Each county budget has an addition adjustment to pay as well as administration's $3 million line?
Yes, so we have budgeted 3.7% market adjustment, so like a cost of living adjustment. We do it a little bit differently here, but that is in every general fund department line. We've also budgeted for a merit pool. Last year it was 4%. This year I'm proposing 3%. So those are what you see in every general fund department. The additional money for the compensation study is sitting in the administration budget, if you want to find it there. We have not allocated that out yet because we're not at that point in the study where I know specifically where those funds are going to be. I think we did put a little bit in road and bridge and motor vehicle because those are also funds that support positions. So, and I do believe that is sufficient dollar amount to cover what we need for the implementation of the McGrath study.
Thanks.
And it's on the outside edge of what we might need for the McGrath study, is that
Yeah,
right?
I think it'll be more than sufficient.
Okay.
We'll make it work. We'll make sure it's sufficient. How about that? Other questions? Okay. So I want to invite our emergency service partners to come on up. So that would be Lawrence Douglas County Fire and Medical, Emergency Communications, and Emergency Management. And Cammie, that's what I didn't print on. Cammie's going to give a little overview of this section and sit wherever you like.
You may go ahead and start.
Yeah.
Good morning. So we have emergency services first, and I'll give you a little intro on the three departments we have sitting here. LDCFM, the current agreement with the city has a cost share factor established as the city pays 100% of fire services and the county pays 100% of EMS services, also referred to in our budget a lot of times as ambulance. The county pays 30% of any cost or expenses determined as shared cost between fire and EMS under the current agreement. There is a proposed expansion of Station 6 and 7, and an anticipated operating expenses are to increase by $921,000, as well as CIP expenses of another $339,000. The city of Lawrence currently has this expansion in their proposed budget. The LDCFM is also shifting their current organizational structure, and there are details on the amount of persons assigned to each apparatus in that memo in their section of the budget book. They're currently funded in the ambulance equipment reserve is the annual ambulance replacement request for 25, as well as the ambulance for Station 6. Emergency Communications Center. ECC is what we refer to it a lot here. The cities in Douglas County adopted a new agreement last year with the help of WSU consultants for a new method of calculating the city payment to the county for 911 dispatch services for Lawrence, Eudora, and Baldwin. Under this model, Douglas County takes responsibility for a third of the projected cost of 911 dispatching and charge Lawrence, Eudora, and Baldwin City a rate based on population for the remaining 2/3 of the budget. The amounts reflected in the proposed budget show those new rates, except for the smaller cities that were allowed a 3-year phase-in approach so that the impact on their budgets would not be as large. So this year, for 2025, you will see Baldwin City and Eudora's amount at 85%, and next year it will go to 100%. The 2025 ECC proposed budget does include $160,000 for the procurement of priority dispatch emergency fire protocols. This initial purchase will include all expenses for onboarding the software, training of personnel with supplemental processes for program initiation. The Emergency Telephone Fund collects fees according to statute and maintains the 911 infrastructure. Douglas County used these funds to pay the Motorola maintenance contract, and you heard from Sarah that we're waiting for some changes on that within the next year so that we have the cost estimated with the best information we have at this time. Emergency Management, the Department of Emergency Management advances counties' capacity to effectively prevent, respond, and recover from natural and man-made disasters, as well as pre-planned events and emergent conditions. There are no changes for the budget in 2025. There is a supplemental request for one full-time emergency management specialist to increase the capacity to train, exercise, and provide outreach. And with that is all I have.
So Commissioners, we just open it up for, any questions you have of this team, either us or our emergency services partners.
We're just going to have all our partners introduce yourselves and what you represent for the audience.
I'm Mackenzie Zell. I oversee our admin division at Lawrence Douglas County Fire Medical.
I'm Fire Chief Rich Llewellyn with Lawrence Douglas County Fire Medical.
Director Tony Foster with Douglas County Emergency Communications.
Kevin Joels, Division Chief with LDCFM.
Director Robert Benecki with Douglas County Emergency Management.
Thank you. Actually, my first question will probably actually be a Sarah question. We typically budget for 2 ambulance replacements every year. We're now proposing to switch to 3 ambulance replacements, in part because of the station expansion. Is that something that with the larger pool of ambulances, we will be anticipating that 3 per year is kind of the ongoing number to kind of keep that, maybe this is Chief Llewellyn, to keep that pool of vehicles active, or is this a temporary thing as we expand and then we'll go back to 2 a year?
I think it's a Kevin question.
Okay.
Unless the chief wants to answer. The proposal for 2025 is that we would be doing 2 normal ambulance replacements. The third ambulance is a one-time, and it wouldn't be every year. It's the one-time for Station 6. There are some opportunities with some of our trade-ins that we could do some extra things within our fleet, but we haven't discussed or determined that yet.
So for 2025, we've got 3, the 2 regular replacements plus the 1 expansion. For 2026, do we anticipate then that being a request for 3?
No.
I think it'll go back down. I'm not quite sure what the dollar amount is. Also, pricing on ambulances is going up substantially, and the lead time is about 2 years now.
Yes.
So I do think it is a bump, but to know what our base amount will be, I'm not confident at this point.
Okay, appreciate that.
There's an opportunity that I think we need to pursue, but I understand that it's difficult to allocate money that's not here yet. So 3 years from now, you don't want to say, yeah, we'll buy you 2 ambulances because we know that. I think our vendor is willing to work ahead, but we have to purchase ahead, or we at least need to plan ahead by getting the chassis on order. And so it's kind of a non-committal commitment. We would just have to strike something with the lawyers and however the contract is written, that if we didn't need the chassis because we couldn't afford them, then we would just give them back to the pool and we wouldn't be out anything. We would just have to, we would incur that delay that's going to be there. If we don't start ordering ambulances now for all the way until 2028 or 2029, we're going to not have an ambulance replacement program that's been on schedule, that has been working for the county. So we need to have some language, I think, if we can start working towards that, probably sooner than later. If not, then we're going to end up probably seeing a year, maybe 18 or 24-month delay. There's no difference in fire trucks the same way as ambulances, unfortunately.
So is it like 18, 24-month lead time on ambulances?
Yeah.
Okay, that's what it's been running for a while.
It's gotten increasingly worse since COVID, but we were about 12 months in the past, but COVID's made it worse and it's just not recovered. The vendor in which we use and the brand in which we use for ambulance chassis is the only brand that's committed to emergency services to make more chassis for emergency services. So it's worked out better for us, and then a vendor that's willing to give some demos if we need them. But we're going to run out of that allotment before too long, and we need to plan ahead for probably 6 ambulances without committing monetarily.
Yeah, we've gotten a timeline in the past and kind of shows how ordering now and when those would come online. So.
Yeah, and we have that now as well. It's the money, like Sarah said, it can change. It's not going to be a standard 9%, but it would be great if it was that way, but we can't even figure out how much milk is going to be next week. So it's difficult to plan for steel.
The question nobody can answer. How stable is the budget request that we're being asked for here? And I recognize we have this odd thing we've been up against year after year, but I know last year was my first year with it, where the city by statute, the way we have our agreement written, calls the shots, but their budget season comes after ours. So whatever changes they make, we then have to absorb after we've kind of closed out our books. So what we have in front of us is still the current conversation with the city also. Is that correct?
I'm sure Chief will chime in, but I do want to say, yeah, I think this is the latest as we know it. But I would say the expansion, I think, is going to continue to evolve and morph while the expansion comes into place and with staffing needs. Again, another reason why fund balance is so important, because it allows us to adjust for those types of things when we, a partner sets their budget after we've set ours. And that's in essence how we approached the 2025 budget, with 5 positions that were approved by the City Commission after our budget process was completed. Chief.
I appreciate that question. The best analogy I've come up with is LDCFM lives in a town with parents who are not living together, but still talk, and we have to go back and forth and talk about money. So I think that's where we're at. The budget that you have before you is the most up-to-date budget as of this morning. That's going to go to the City Commission as the city's recommended budget.
And of course, one of the pieces that's in there is changing the staffing on fire trucks. Can you just talk us through that, the recommendation there?
Yeah, the direction that we received ultimately throughout this process, or at the end of this process, is to develop a budget that has 4 basic elements. One is it matches the funding, the target funding that we've been allocated. It reduces service level to get to that target funding level, and in that it changes staffing on our primary suppression apparatus from 4 firefighters per apparatus to 3. It adds an EMS element into the system, and we anticipate staffing Medic 6 starting next year in reflection of the statistically significant increase in EMS calls that we've experienced and continue to experience. And 4, that it plans for station expansion, looking at the staffing and funding of stations 6 and 7, which we anticipate approximate opening dates of 2028 and 2030. So you can see the potentially contradictory direction that is there, and the need to balance a lot of these asks. So the short answer to your question is yes, we're looking at decreasing staffing on primary fire apparatus from 4 firefighters to 3.
Couple pieces I'll pull on and turn it over to. So the EMS, bringing another EMS ambulance online next year, what is the location for that? And are you pulling that from the existing pool of ambulances? Because I know we keep some, kind of spare to fill in so that we never have something down.
You're talking in terms of the physical ambulance unit? I'll let Chief Joels answer that one.
Yeah, like you just alluded to, we do have reserve ambulances. We'll pull from one of the reserve until we get the new Medic 6 in service. And then I believe that initial location will be at 19th in Massachusetts, which is our, we call it 1.5s.
Commissioners, did you want to chime in? Or?
I want to say, we're in the last year of our agreement, our joint governance agreement with the city of Lawrence for Lawrence Douglas County Fire and Medical. And then so that ambulance would then be part of that conversation related to standards of cover and how many ambulance and fire apparatus are on the street at any one given time. So we do have, our hope is that we can have negotiations on what the standard of cover would be, and there'd be information presented to the commission on that. I'm hoping we can put it off till 2025, but we probably should start talking about it this fall.
So when I look at the budget request, it's an increase of 1.148 million, right? Which is about 12% more than what LDCFM receives now from the county. That concerns me because we've seen our property valuations go up by 6.89%. So when we talk about setting a budget long-term, this seems like a challenging way to stay sustainable over time if we're asking for 12% increases, 15% increase, whatever that is. I didn't go back to my past 6 years of budget books, but I'm interested in hearing. I'm not saying that's not the need, because I do believe that there's a need and safety is very important and all those things. I'm interested in hearing, besides reducing the number of firefighters on a truck, especially in the EMS area, what other considerations were made for cost savings, and how did you determine those were not the things to recommend?
I can start on that. This is Mackenzie with Lawrence Douglas County Fire Medical. So throughout this process, as Chief alluded to, we made multiple cuts in order to get to the budget, the number that was given to us from the city of Lawrence. And so we did make cuts in almost every line, and then finally got to the personnel. And so as far as sustainability goes, there are some things over in 2025 that we're prepared for that are the PPE, as far as when we need to reorder it. So those standards, we have some big orders coming up in 2025. So those things we have talked about moving some of those orders into CIP. We have a CIP project that has something for our SCBAs for this next year, but there are some other items that are in our operating budget that we're hoping to establish a more, I would say well thought out plan to order those instead of having them come out of our operating budget.
Yeah, I think the one question or one answer related to sustainability has to do with the long-term ability of the governing bodies to keep up with increased costs of stuff and labor. And we talked about ambulances earlier. A challenge is costs go up every year. The cost of our commodities typically rises with fuel increasing. Even if fuel costs stay the same, if we're running more responses, we're going to use more fuel. So as we look at costs and sustainability, we have to consider both increases in costs and increase in usage. The long-term part of this budget that you've seen before you, at least from the city side, the proposed budget will fund the expansion that we anticipate in 2028 and 2030. And from the city side, that's predictable. So I think that can be translated to the county side, but the challenge is with our EMS agreement still hanging out there and expiring at the end of this year and not knowing what that's going to look like in future years. There is a challenge for us to forecast that. And I apologize, we can't give a perfect vision of the future, but we recognize the sustainability of budget asks is a significant issue.
I could add too, this budget is built on some fee increases that we would hopefully put into place later this year. We would need to change city and county code for those. So we're hoping to increase our fees on it. And then also there is a conversation happening at Lawrence Douglas County Fire Medical related to non-emergency transports. So that is another method that I think LDCFM is doing to make sure that they're using the staff they have in the most efficient manner possible. I think also something that might be really helpful, Chief, is if you came back at some point in time and talked about I appreciate what the commissioner said about the value, the growth and valuation, and then the increase in the budget. But I'm not sure that our call volume increases are the same as our rate of growth. So maybe if we had more conversation about ambulance, calls for service in both fire and medical, and how those are increasing, and how do they relate both to just costs and assessed valuation and the budget as well.
Yeah, we're happy to come back at a future date and provide detailed analysis of responses, the calls that we go to. We've had pretty steady growth as far back as 2006. From the numbers that I've seen don't typically go back farther than that. A couple years of either flatline growth or small growth, and a year of some decrease, kind of the COVID year, which was pretty common across the U.S. But outside of those years, it's been pretty linear growth, and that the line as we look at it is significant. The amount of EMS incidents that we respond to every year grows significantly. It's a big part of our business. The actual number of fires we go to is actually stayed fairly flat since 2006. I think that's attributed to some fire prevention efforts, some newer construction that's happened over that time. But the population largely drives a lot of the EMS incidents. So growth in population and then changing in population demographics as the population ages. It's also driving increase in EMS responses.
Yeah, I think I appreciate that, Chief, because I think the expectation is high for our community members on the response that they will get. And yet there's also a call to reduce our costs for it. When that comes to tax, you talk about the governing bodies. I'd just ask you to adjust that a little bit and say the people of Lawrence and Douglas County, right? Because they want more. What I hear you saying is they want more calls, more service, and we also hear for less money. Would that be accurate? And so when I talk about thinking about creatively about some of these things, and I'm glad you said non-emergency response, are there other ways? What I haven't seen over time, and what I encourage you to continue to think about, is being really articulate about what are the cost savings that you gave me one, right? But like when we looked at expansion, it's noted that the expansion means we need EMS right away, but we don't need fire right away, right? We don't need a fire apparatus right away. So my question is like, do we need another fire station, or do we need something at a little lower level for EMS because the real need is EMS? I know we've talked about that, but I think that's the more nuanced conversation that I hope we can have here to understand so the public can understand a lot. What that would help is for them to reduce the number of calls they're making. I'm not telling somebody not to call because they're in an emergency situation, but that's what's driving our costs up. And yet we still want that reduced. Our job is to be, how can we do it more effectively, more efficiently? So that's where those questions are coming from.
I'm not going to let an opportunity pass for me not to talk about how it is not just simply, it's not fair to say fire versus emergency medical services. Before Lawrence Douglas County merged in the 90s, police officers were first responders to medical calls. Traditionally, ambulances and EMS was defined to ambulances and transport. So I think we need to think about first responders. And that's really what I think the beauty of our joint agreement is that the vast majority of our costs are shared because firefighters are first responders, whether they're on a fire truck or they just show up with a Pulse Point app, they're first responders. And so I think it challenges how we think about who pays for what under joint governance. And it's something I think we're going to have to continually work through. But it's really important to note that if you've ever lived in a community that didn't have joint fire and EMS response, it's a more inefficient system because you have, sometimes a county ambulance provider showing up to a scene where a city fire truck is already there and they're in competition for resources. So I really do believe that our model is more efficient for our community, but it does have some complication because we have to work together to jointly fund it. But, I think if you've only ever experienced fire and medical in Lawrence, that's not how it's done in some places. Oh, I'm losing my microphone.
We lose all of them? No.
Okay. Oh, I don't remember.
Pardon us while we reset our technology.
I think we're still live on Zoom. Our audio is off. Maybe Robin could come on if she can hear us. Well, yeah, that's the Zoom.
I can hear you fine, Sarah. This is Robin.
Do you want to take a break or do you want to?
I think we'll have to for the record. I have a lot more questions that we'll need to have covered.
Okay. Well, I just didn't know. I mean, we can keep going. We can keep talking. It's just not on Zoom.
I think for the public record, don't we need to capture all of it?
I mean, we don't do exact. It's fine. We can take a break.
Let's give Starla 3 minutes and we'll come back.
Okay.
So. A technical difficulty there, but we should have everything back up and recording. And since I got the mic, I'll ask the next question. We were talking a little bit about like what other ways to reduce costs overall. In looking through call volume data for LDCFM, what really stood out to me was that sharp increase in the non-emergency calls, the calls for service and the false alarms. And so I'm just wondering if there are conversations about I think those are also calls that increase burnout because people are showing up and the skills that they train for are not the skills that are needed for that. There's a lower level of skill needed. So that's one thing I'd like to hear kind of more response, like what are the intentional ways of digging into that data to find out where we can, as a community, solve this in a different way that doesn't involve the most expensive vehicle we own coming up to that call. Another piece was, I know KU does not participate in funding any of the operations for LDCFM. They don't pay, is that correct? They don't pay property tax, they don't pay into.
They pay fees for service if they have extra services, but they don't, you're talking about for just general fire service. Okay.
For emergency calls, they're not covering any bills for that. They're covering like if you cover a football game or something like that.
Well, and if a professor has insurance and they call an ambulance, then that can be charged to those fees.
what I'm getting are more like the, the dorms and the on-campus living situations where what I was hearing from my Station 5 ride along was that there's a lot of burnout associated with showing up to those calls when really what KU needs to do is change out the kind of smoke detectors so that they're not going off when people cook. But there's no incentive for them to do that because they don't pay anything for that call. I think that's a conversation that needs to be had. It's hurting the community overall to give KU a free pass on some of those calls. And then the non-emergency transport, it sounds like we must have 5 or 6 a day where we have ambulances, our ambulances that we pay for with county dollars, leaving the county for a non-emergency transport from LMH to someplace else. And that also contributes to burnout, my understanding. Feel free to correct or address. But also it's for the rural area, which is we have to provide services equally to all parts of the county with our funds. That means moving trucks out of the rural area to cover the higher population density. So each time that happens is a detriment to places like where I live. So finding ways to tackle that, I'd be very interested because I think it's a win-win if we can figure out how to not use our services for non-emergency transport. Do you want to respond to any of those before I keep going?
Yeah, I'd like to jump in before you keep going. I have about 3 categories to talk about first for your first questions. Non-emergency calls and strategies to reduce non-emergency calls. I'd like to chat about that first. In late 2023, we launched the Mobile Integrated Healthcare Program, which uses paramedics who are focused on dealing, as Chief Joels likes to say, with the slow medicine problems. Oftentimes we're called or dispatched to an incident after someone calls 911, and it's a fast medicine problem. Someone has a heart attack or someone who's having a stroke. They need to get to the hospital right away. The slow medicine is folks who need help, but they don't necessarily need to go to the hospital. They may need help getting their medication correct. They may need help with just basic daily functions. And oftentimes 911 is people's lifeline. And prior to the alternative response conversations that have been going on over the past year, there were essentially 2 buttons when someone called the ECC. There was a blue button for police and a red button for fire. We'll just stereotype on the colors. But those are the tools that we had to get those problems addressed. So with the launch of MIH, we're able to visit folks who are what I would call high utilizers of our systems and get their needs addressed. An example that I'd like to talk about is somebody who is calling us a lot for lift assist and ultimately identified that the individual's bed was too low. So the MIH team found a resource for the person to get a taller bed, and the calls went from many multiples a week down to 0 for a time period. And I don't have the exact numbers, but that's the impact of that slow medicine delivery and reducing the overall system impact from these folks. Other strategies that we have for dealing with non-emergency calls. We're working with the ECC currently to revise the way we dispatch and analyze EMS calls. There's an underlying system that's already in place and being used called the ProQA system for emergency medical dispatch. Over the top of that, we've overlaid the Douglas County system for dispatching emergency medical dispatch, and it's taken it from 6 buckets down to 3. And I think we need to better refine our buckets, if you will, and better dispatch that. There's a level of dispatch or a level of incident within ProQA that when the system is mature, those incidents can be offloaded over to a nurse line. Other communities are doing that. And so if somebody has, I like to talk about in my mind, the kind of weirdest use of 911 that I saw in my career in operations, and it was a dispatch for pain from an ingrown hair. And I know ingrown hairs can be painful, but it's not necessarily appropriate for an ambulance to go there. And if we had the ability to get that person over to the nurse helpline, that would reduce the impact on the 911 system, reduce the impact on the emergency response system, and get the person the right help they need. I don't think that person should go to the hospital, to the emergency room for that pain. You know, there's I don't want to just create broad categories, but there's stuff that shouldn't be seen in the hospital. And if we can get those folks to a better solution, I think that's going to help reduce our non-emergency calls. Want to talk a little about KU expenses, and we do visit KU properties. We provide fire protection for KU. We provide EMS protection for KU, where we view KU as a partner. We do a lot of, I would say, extra services for them that we talked about do generate revenue, providing EMS standby for events. But we do show up to KU properties to make sure that nothing's on fire when we receive fire alarms. And we are working on a process to bill for what I would call false fire alarm responses. And that's in the works. It's been in the works since I've gotten here. It's not been a fast process. So it's something that is still working through our process. We don't currently have a contract with KU to provide services. We have a handshake agreement for the EMS standby services, and that's kind of the what I heard a lot of when I first got here is we have handshake agreements, or we have agreements to get up there, and I really am working to formalize those. So we're working to get a contract in place. Lawrence Police Department got a contract to work through or with KU to address the reimbursement for when they provide standby services for events, and that's where we're headed as well. And I think the false fire alarm issue will come right after that. I do want to talk about non-emergency transports. We have what I've been calling a governmental monopoly on ambulance transports in Lawrence and Douglas County. Chief Joels has been working to address the language there, so the opportunity exists to have another entity come in and provide non-emergency transport services. We want to reduce the time that our folks are on the road between here and Kansas City, between here and Topeka, or even between here and Tonganoxie when they're taking someone from the hospital to home. That's not, it's a service that ambulances can deliver, but it's not necessarily a service that an emergency ambulance should be delivering. We want to keep those folks available for the emergencies. We have, to address your comment about some of the rural areas of the county, we started to look at how we staff ambulances and how we staff the stations that are in Eudora and in Baldwin City when the ambulances are out of those or out of position for non-emergency purposes. We've started sending ambulances down to Baldwin City to staff that station when Medic 11 is in Lawrence for some purpose other than an emergency. And it's paid off. We've had a response to cardiac arrest because we had a unit down there. Backfilling is the common terminology. So, you know, I think someone said, well, you're lucky with that. I said, well, that actually was a plan. And so it worked out for that patient. So we are working to address those challenges. Another just a little tidbit is we're in active discussions with another EMS agency outside of Douglas County, another public EMS agency that may provide mutual aid for areas of the county that are harder for us to get to when we can't get there. So that's an active discussion.
I'd just like to make sure that our numbers are correct on the transfers per day. It's only about 3 would be the average. We were only in 2023 was 1,106. And that's a combination between emergency and non-emergency. So there's 3 buckets, as we keep using that word. There's hospital to hospital, there's hospital to home, and then there's hospital back to either a nursing facility or a rehab facility. So those are the three. Would be trying to reduce the non-emergency transports. And like Sarah alluded to earlier, with some fee increases and some loss of revenue because somebody else will be taking those calls, we should balance out, would be my guess. If not, still be able to maintain on the budget or services income, I guess.
Commissioners, I have a couple more, but I want to open it up to others.
Thanks, Commissioner Millie. This is Commissioner Reed. I want to note the time. We've got about 15 minutes left budgeted for this section of our morning, and a couple other partners here. I have one question for LDCFM, and then I have one question for emergency management. So I'm interested to understand how and why the department decided to change standards of cover to reduce from 4 to 3 staff on the fire apparatuses as proposed here after we recently had an increase in staff overall to the department. And while we are talking specifically about not having yet figured out what our started the formal process of figuring out what our renewed contract or funding agreement will look like between the city and county. We'll just add some commentary to this that I'm struggling to understand how standards of cover have been decided to be changed without seemingly a full process, certainly not, and maybe this is part of it, the budget process between city and county, but not a very full process to look at standards of cover overall. And to Sarah's point about, an increase in emergency, lots of talk here about increase in EMS calls over time, and that potentially having impact on the shared cost agreement in the very near future, the imminent future. And changing standards of cover seems like a very important piece of that conversation. So I'm struggling to understand why this proposal represents that before we've had that conversation.
As I hope you can imagine, this budget process has been extremely challenging, both technically, professionally, and personally. The reduction of assigned staff is not a direction that I want to go, but the budget challenges that the city of Lawrence faces required the executive team to identify how to deliver all the services of the community within the allotted funding that the community provides. So that's the quick answer. And it's a challenge because we're here talking to you as in dual governed entity. We report to both the commissions in the county and the city, and ultimately we report to the citizens across Douglas County and Lawrence. And the level of funding that we've received and the accompanying direction to reduce service levels is reflected in this budget. And it is a challenge to have dual governance and to bounce back and forth between commissions. I can't stress that enough. It's a challenge to bounce back and forth. The standards of cover question is a good one. We have a number of firefighters that we expect to be assembled at an incident to manage that incident, called an effective response force. We have those numbers for both fire incidents and EMS incidents, and we expect an impact on service in terms of getting additional units or the need to get additional units to an incident in order to get the number of people there that we need. We haven't yet operationalized any changes because the changes aren't aren't confirmed yet. We don't have a confirmed budget yet. So we're getting a lot of questions about how is this going to work? And we don't know because this is just a recommended budget recommended to the city commission and then subsequently recommended to the county commission as the part of the process. And until we know exactly what our budget's going to look like and the direction we have for staffing, we can't operationalize that. And I also want to acknowledge that we're in a time frame where we don't have a county-city joint agreement yet renewed. It expires at the end of this year, and we're working through that process. And the timing is never great, it seems like.
I appreciate that, Chief. Go ahead.
Just one very last thing
Sure.
to add. Under the new agreement, the percentage hasn't changed, because we don't have the new agreement. So all the numbers that are reflected in the documents are with the current agreement numbers.
Yep. Thank you for clarifying that. And I just think that we've talked as a commission over the years that there's an anticipated change in that cost share because of the natural change in the way services are being delivered and perhaps some restructuring in organizational capacity and staffing standards. So I appreciate all of those comments, Chief, and I know that that's a difficult question, and I know it's hard to have an answer for it. Just felt important to state that feels off kilter to me, I think is the best way that I can describe it. And so I totally recognize the strange position you are in between two governing bodies with two different processes and a weird timeline, as you described. I just think that for me, I'm interested in having a lot more information and understanding from broad perspectives about what standards of care mean and look like and should look like in our community, and for that to be a larger conversation that is not dictated by the city's budget struggles. So I have one more question that I just want to make sure I don't lose track and switch gears to Robert for emergency management. We have one optional request from you to add a brand new staff position, right? It's not one that exists currently. It's not like adding an additional emergency. I'll let you give the title instead of me looking back at my notes. But can you just give us a little bit more context about what you envision that position could really help in terms of growing capacity and why a new, different position than what the staff currently has?
Sure. I just want to start with a little bit of history. The county had a one-person emergency management staff until 1993, and they added one full position. I was at hire back in 1993 here in Douglas County. Since 31 years, over 31 years have passed, the population in 93 was 85,000, and we know what it is today. The other 1.5 FTEs that work in emergency management are grant funded with emergency management performance grants. So they're on board. Although it's a strong grant and we typically get it, they are still grant funded. So just a little bit of history there. What this position would be an emergency management specialist, that would be the title. They would focus on training, education, exercises. And it's not that what we look in this position for is to be able to do more. An example would be when we are able to get an exercise in every year, but it's usually with a hazardous materials grant. And so a lot of you are invited to that, participate in that. But that grant's a $30,000 grant just for this year to do a tabletop, which we're doing next month. We did an exercise in working with IT and cybersecurity back in the fall of this year, and that exercise in itself took so much manpower and coordination and time that we want to do more of that. We want to do more with internal county departments exercising. We want to do more with partners in the field. We want to be able to do drills internally, which we struggle to get to. And this position would focus on those areas while we still have our other outreach and planning that goes on in emergency management.
I have a question for Robert, and then one for Tony. Robert, one of the big changes here is maintenance for warning sirens. How do we decide when it's time to replace a warning siren versus continued maintenance on it? Because it looks like our warranty ran out, and that's why our maintenance costs went up. Is that correct?
That's correct. So on the new sirens, when we do purchase the equipment for a new siren, it has a company-backed warranty for a period of like 5 years. And then once that expires, the maintenance contract has to be increased. I will tell you that you're looking at that line item and that it's reduced for this year for 2024 in re-estimation because we're still working on a project that you guys approved last year, which is the API interface between the Everbridge and the siren system, as well as some pooled money in the FirstNet for the cellular backup, which is why it's re-estimated lower. But we anticipate that to be back to normal next year, and hopefully we're closer to getting the API online.
So what is the typical lifespan of, if 5 years is our maintenance warranty, what's the lifespan of that siren? When do we?
Yeah, so we're in the process of ordering equipment to replace sirens that were installed in the 90s. So, and this is the recommendation of our service, our contractor, that just all those electronics need to be updated, cabinetry, rusting, poles, but we're getting 30 years out of them and then replacing them.
Thank you. And then this may be as much for Sarah as it is for Tony, but when I look at the big change for ECC is the new software. I think it's a one-time cost of 132, but the ongoing is 28, right? We have the 19,000 plus 9,000. So I'm wondering when we get to actually doing the budgets, if we can, because that, I always use that, what our assessed valuation increase is to sort of figure out like how much, where is our room to grow in some of these budgets? And that pushes it to like 20%. But if it's one-time cost, it gets us down more.
Good point.
Closer.
Yeah,
Okay, thanks.
you're right. We'll get that modified
Good job,
so that
Tony.
when you're doing deliberations, you know what that amount is.
Thanks.
I know we just have about 2 minutes left in this cycle, but Tony, I also wanted to ask about the software. Why is it needed? Is it replacing a software? What are the benefits of it? It's a big cost. Software is always a big cost.
It's not replacing anything. It's a new addition. Currently, we use EMD for medical protocols, and this is going to be adding the fire protocols on top of our system. What it does for us is it gets a more structured call-taking experience for people that are experiencing a fire-related incident. And then also what it does is on the backside is if we need to start tiering our responses, we can do that with the software. So it will provide determinate codes that then we can actually structure our responses to.
And also within your budget, I'm trying to pull to the right page, but like the first due contract and the I am responding contracts, do those fall under yours or do those fall under?
No, those I believe are purchased by the county.
Okay, so they're under admin?
The I am responding, that's CFD1 pays for theirs. I think the individual agencies pay for theirs. So the sheriff would pay for his and CFD1 would pay for theirs.
Okay, I just didn't see it listed in there, so I was curious.
Yeah, first due
list
is
them all out.
individually paid by each individual department. And I believe that we have an I am responding contract through the county.
Commissioners, we've hit a time boundary for this. Any one of you, we could certainly ask a lot more questions, but I very much appreciate your time and the documentation that you've given us. Commissioners, do you have any final questions for this group before we move to the justice system? Thank you all for being here. Appreciate it. We'll
Okay, so-
just take a minute to reset. Sarah, did you have some introductory comments or follow-up?
Katie's going to give the introduction for this team and invite the members of District Court and Kansas Holistic Defenders up. And Pam, if you want to come on up too. Thanks, guys.
So I'll put in there that it's 28,000 going forward per year.
Yep.
Because that's listed in there.
Yep. You want to share microphone? Yep.
Good morning, Commissioners. This session is focused on the budgets of our criminal justice partners, including our district court, our district attorney's office, criminal justice services, the district court trustee, the CJCC, and our community partner, Kansas Holistic Defenders. 2023 brought many challenges to our justice partners, but with each, these partners and their staff displayed resilience as they worked together to face each obstacle. Beginning in March of last year, district court prepared almost around the clock for the transition from full court to Odyssey, which was no easy feat for our court administrator, our judicial assistants, and our court clerks. Only a few short months later, Odyssey experienced a cybersecurity incident and was offline for approximately 3 months. This incident resulted in the immediate transition of all of our court partners to paper filing. Although not in 2023, but keeping with our theme of resilience and recovery for these partners in this system, the month of January 2024 brought our court partners the restoration of Odyssey, along with a flood, followed by a fire and another flood in the basement of the Judicial and Law Enforcement Center. During each of these events, all of these partners continued to work together to work around and through each of these pressing challenges while minimizing any delays in the administration of justice in Douglas County. In May of 2024, we celebrated the first full year of the operation of the District Court Legal Self-Help Center, which was funded by the County Commission in 2023. Since its opening on May 1st through the end of 2023, the Self-Help Center assisted individuals on 258 cases, the majority of which were related to family law. So far in 2024, the Self-Help Center has assisted individuals in 551 cases. An additional enhancement to our local justice system landscape came in October of 2023 with the opening of the Board of Indigent Defense Services, or BIDS office in Douglas County, which provides defense counsel to indigent defendants charged with felonies. From these partners, you'll see supplemental requests from our district court, including a staff attorney to assist our judges with legal research and document preparation, and funding to sustain the AmeriCorps position in the Self-Help Center. While the United Way did lose the AmeriCorps sponsorship for Douglas County, Self-Help Center staff are seeking supplemental funding through the Kansas Career Work Study Program to provide funds to sustain this position. With that, I would turn this over to you all for introductions of all of our partners and any questions and discussion.
Could we very quickly pass the mic around, have everyone give their name and affiliation? Thank you.
Sorry. Good morning. I'm Pam Weege. I'm the Director of Criminal Justice Services.
I'm Linda Kester Vogelsang, Court Administrator.
James McCabery, Chief District Court Judge.
Mary Beth Diaz, Court Trustee.
Suzanne Valdez, District Attorney.
Sam Allison Natale, Co-Executive Director of Kansas Holistic Defenders. Tamber Hepner, Co-Executive Director of Kansas Holistic Defenders.
Brandy Nichols-Brakovich, I'm the Director of the Legal Self-Help.
Commissioner Kelly.
Long reach there, yeah. Pass that all the way back.
Thank you. Commissioner Kelly, it looks like you had a question to kick us off.
Yes, I have quite a few questions. So maybe start with criminal justice services. So there was a number of budget lines here, Pam, that I'm looking at 456 general fund line that really went up significantly. And some of them I don't see past expenditures matching that. So I'll just pick UA 61,525. I mean, that I'm on page 107. Yes. I guess my point is I don't want to take a ton of time deep diving into things, but there were some large jumps in some of these expense lines and was just curious what led to some of was there background on that?
Well, your analysis, we actually went down from budget. Is that the one you're looking at?
Well, so what I see in the 2025 budget is 32,500, and what I see in the 24 estimated budget was 27.5. I see that as an increase, not a decrease.
The base budget was 37.5. So from budget to budget, we've reduced it by 5,000. So you're right, we're still above what we spent in 2023, but we were trying to get it down, but we're just not sure.
Okay.
It's hard to know the volumes. So.
But our largest expenditure in 23 was 19,240, right?
We could cut another 10 if you'd like.
Okay, yeah. So Pam, there's a number, especially in that contractual space, there's a number of dollars that seem big. I just wanted to give you the opportunity. And then Sarah, maybe for you, our Burton Ash, I mean, that's 268,000. As that comes out of general fund, that doesn't come out of behavioral health sales tax?
Correct. This is for the behavioral health court, and it's been budgeted out of criminal justice services.
So is that one we might want to look at for?
It is certainly something that, and the 3 lines above it for DECA and court alternatives could be moved to the behavioral health fund as well.
Okay. And what about CJCC, looking at the evaluation? Again, I think that's one-time funds, 150,000. It's drug court, it's evaluating drug court and behavioral health court. Is that one that we could take from the behavioral health sales tax as well?
It sounds like that would be an eligible expense.
Okay. Those are my first 2 questions. We'll let somebody else go.
You're welcome to keep going if you'd like.
Nope, someone else.
Flip pages.
Good morning, everybody. This is Commissioner Reed here. I just wanted to hear a little bit more from District Court about the 2 option requests that we have. So just to add a little bit of color and context to why a research attorney feels necessary for the District Court, and any context you can give about what that might look like in other district courts, if there's anything related to, the state judicial system that supports that for different judicial districts across the state. I'm just curious research attorney for judges is a new concept to me, so anything you can do to kind of give some context would be helpful.
Yeah, Linda KV can fill in on how we've done that in the past. We've contracted with some attorneys that contract with different jurisdictions. So Shawnee County, us, I think she's done some work for Johnson County as well. And so it's been a system that's in place where if you have an issue, you send an email to that staff, to that attorney, and Linda can tell us the details on how that's compensated, because I'm not 100% certain. But in talking to the district judges this go round, the comments that I heard were that we're all very busy. If you look at our numbers and compare the OJA stats, we could really justify almost another full-time division judge position. And, sending that email out, you're not asking for simple issues. You're asking for stuff that probably doesn't come up a lot, has a lot of nuance. All of the judges told me they felt like that's something that they would use more if we had an actual staff attorney in place. So, you know, and it's not just legal research, it's taking the work that the attorneys turn in and synthesizing it for you. You know, if a judge has to sit and take 3 hours to watch videos, that's half a day out of the judges. You're not going to get anything else done. Whereas if you had a staff attorney that could brief you on this is what was, you know, the salient points, and this is how it affects the case that we're talking about. Civil stuff comes up from time to time that, you know, just that's the stuff that to me comes up where, gosh, I've never even really thought about this aspect of the law before. Having somebody to sit down and talk that through with, it's an efficiency thing. So my own view is if we don't get it, we'll continue to do the job that we're doing. If we had it, we think it would make for efficiencies, better work product, that sort of thing. So.
Thank you. I appreciate that context, Judge. Linda, can you clarify, is this something that's currently represented in the budget that's being paid for the sometimes calls that are made for this type of assistance with, you know, contracted rather than it being in-house like you're requesting?
That is correct. Under our personnel line item, we have a staff attorney who actually works, as the judge said, for both Shawnee County and Johnson County. And I don't think we overburden her because she's overburdened by the other two courts. And so it's just when the judges can get in a request to her. So it's an hourly pay that we do.
Do you mind sharing how much hourly it is if you don't have, or a ballpark of how much you've spent on that? And
On page
in the
17.
recent year? Okay, I'm sorry.
And while Linda's looking at that.
Well, in the personnel line item, there's more personnel involved, right? Or is it broken out and I just didn't see that?
I think it's
piece?
that 50575 line for research attorney on
Okay,
page
thank
17.
you. I appreciate
What's
it.
that
That's me overlooking that line. Go ahead, Judge.
Well, I was just going to comment, because that attorney's working for bigger, busier districts, at least my experience has been when I would send, I think I made more efforts to use that person in the past, and what I would get is, I'm running about 2 weeks behind. Can I get this to you in, 2 or 3 weeks? And so my own way of doing things is I don't really think of it until probably, maybe I should have thought of it sooner. I think to myself, I'll get to that. And then I realize I'm not going to get the time and I reach out. I've just sort of gotten away from that. And I think the other judges have had similar experiences. So we don't utilize it as much as we can because we're sharing that resource.
I'll ask a quick question about self-help, the Self-Help Center. You mentioned as far as supporting the AmeriCorps position, it's a small number of dollars, but that part of that would be to move to other parts of the county, so not just Lawrence Public Library as the outreach. Do you have some thoughts about where else that might happen?
Yeah, so currently we are at Haskell Light has invited us in, and we have serviced them just as a temporary to see if they like it. So we plan on moving back into August as the students come. Now that I am back from a little break, I have a plan to meet with the city council in Lecompton and just reaching out to any place that might like to have us go there. So we're really kind of looking where all we can expand. And one of the things that we did look at when considering that's why I tracked the zip codes to make sure they're tracking with the percentage per Douglas County. So if anybody has any suggestions on where to go, I'm really open to them, but that is really what right now, we feel like we've got 2 in place. We know how to do it and we can really get going.
Okay, thank you.
Thank you.
So we have a number, this is for Kansas Holistic Defenders, and maybe also just a broader conversation for us as commissioners. I know we're not deliberating, but we need to talk about COLA increases and COLA increases for community partners. So I want to make sure my calculations are correct because I don't always do the right math. Currently, my calculation is that Douglas County funds 58% of expenses for Kansas Holistic Defenders. Does that sound about right?
Yes.
Okay, and with the proposed budget here, it will be 54% of the total budget for Kansas Holistic Defenders, right? Okay,
Yes.
good. So more of your, did you hear earlier, you may not have been here earlier when we talked about pay increases and merit pay. Did you hear the percentage that was shared?
No, we didn't.
So Sarah, you might go over, would you, what we put out for Douglas County departments, we're looking at 3%.
We're looking at 3% merit pool and a 3.7% market adjustment.
Right. So then when I look at your requests, those percentages are significantly higher than that 3.7. Help me understand why we should pay more in increases for salaries for a community partner than we would for our Douglas County departments.
I'm not aware of how much, well, I guess I'm finding out now about how much you're doing for existing county programs. Certainly would be happy just to be on that same match as far as going up. Our calculation was basically created by taking the wages as they would have existed at the time the contract was originally created, and then correcting for the amount of real inflation that's happened since then, so that our staff are not losing or being paid less in real wages year to year. I don't necessarily think we should be paid more than other county staff, but I do think that there are some benefits that go to county staff that are forms of compensation that aren't made available to community partners. For instance, capers, retirement, those sorts of things. And so I understand certainly that we shouldn't be perhaps ahead of where county staff should be, but I do think that because, as you mentioned, the majority of the funding for our organization comes out of the county, and we are in a real sense partially a creation of the county, that we should be kept on par with county staff in terms of compensation and other benefits that are made available. Does that answer your question?
And it invites another, why would, and I think this is something we just as a commission need to talk about, is what would be the negative for Kansas Holistic Defenders to become a county department? At some point, when you're asking for things like 401ks and capers and all of those things, it may be more beneficial to your employees to actually be a county department. I'm not proposing that, but I'm saying this sort of dual system that we've created with our community partners, it really creates a tension around this is what we need to do the work, and yet the county at 58 to 54% of your budget has no authority in making those decisions for your organization. So I don't know that you need to respond to that. It's just something for us to continue to talk about.
I think I'd like to just add a little bit there. I think it puts staff in a difficult position because, if I were to advocate that, it begins to look like administration is trying to take over a nonprofit, because really, I think it comes down to direction and vision. Right now, Kansas Holistic Defenders is an independent nonprofit that can choose to decide what it wants to work on, who it wants to defend, and what kind of cases it takes on, what kind of grants it goes after. If it were to become a county department, those choices would be up to you as the county commission and me as the administrator. So I do think, it's a conversation we have to have, but I do think it would mean a loss of autonomy for some of those agencies.
There also ought to be benefits to being a nonprofit in terms of some of your other funding streams that you wouldn't have available then. So I don't know that I want to go down that rabbit hole very far. But I do have some questions about your budget overall. I see in part that there's a large increase in revenue intended for bids vouchers. So is that contract work you're taking on in addition to the work that the county participates in?
It's not exactly contract work. So, Kansas has this weird system where felonies are paid for by the state. Misdemeanors are the responsibility of the county. So when we have we will sometimes have our clients who are charged with a misdemeanor and then pick up a felony. We have experimented with different ways of dealing with that. When bids came online, those felonies were going to the bids office, this had an advantage and a disadvantage, the disadvantage being that there were two attorneys spending their time for what is essentially very similar to one case. Secondly, we've been told by staff that we're looking for braided funding, that don't want to be the sole funder here. And so where we are doing felony work, being able to submit a voucher just like any panel attorney is good work for our clients, and it also brings in funding from the state to our office that offsets what the county is spending. Our hope is to be able to bring on, we need an additional attorney, and so figuring out how to finance that. I understand we put in a request last year for an additional attorney because of where caseloads are at to insulate us from turnover. That wasn't a possibility from the county last year. So now we're looking to see how else we can fund that position. One of those ways is by increasing our voucher work on felonies, not just for the clients that we have where there's what we call a crossover case, but also looking into whether or not we can take on additional felony work to pay for additional staff as a way of bringing in more attorneys to do more work for the county without the county having to pay for it. Does that answer your question?
It does. I have a few more, but they're going to have to be quick because we've got a lot of other partners to get to. One is a sharp increase in grant revenue anticipated for the budget. Are those grants that are identified, or is that just a kind of a hopeful line?
That is right now hopeful. So we had at the time that we had put this in, we had a grant out to Arnold Ventures for about approximately $300,000. We'd been working with staff at Arnold Ventures on that grant for about a year. There was tremendous staff turnover at Arnold Ventures. I don't know why. And they've also gone in a bit of a different direction in terms of funding. We just learned 2 weeks ago that we did not get the grant that would have funded a study to better compare our outcomes to panel attorneys. So now that said, we are still aggressively going after other grants to hit that number, but that is at this time aspirational.
Also contributions, looks like when you started in 2021 that you started with a very large portion of contributions, which shows some energy in the community and interest in the nonprofit. That's decreased, but does it look like you're on target for the 45,000? You didn't change anything from the adopted budget to the current budget. And is that something that you're likely to be going after more or increasing?
Yes, we are still trying to engage with our funders to bring in that funding. I'd say there are two major differences. One is when you're first starting something up, people are much more interested than in sustaining things. Second, I at that time was just sort of full-time being able to go after fundraising in addition to the other parts of building the office. But we are, and our board as well is very active in terms of bringing in funding from donors to continue the work.
So still hoping to hit that 45 for 2025.
Hopefully that's a conservative statement.
Final question, and we'll turn it back to the commissioners. In terms of fund balance, I know it's a aspirational budget for 2025, but the idea was to put an additional 56,000 in fund balance through the course of the year. So a 10,000 increase to fund balance anticipated for this year, 2024, and then anticipated for 56,000. What is the goal you're shooting for in terms of like how many months of operating capital are you expecting to have on hand, like relative to your expenses? Do you have a goal for that?
I mean, in 2025.
You've used them.
In 2025, I mean, the goal would be to have 6 months in reserves. But conservatively looking at that, we're hoping to get about 2 to 3 months.
Thank you. Who would like to be next? Commissioners? Okay. Let's see what else I've got. Do we have any questions for District Attorney? Okay.
Tell them that, yeah, only if you have questions for them. So
Hate to use time and not ask questions.
can always take a short break before we move on at 11:30.
We can do that. If there are no more questions for our partners, we can take a short break. So thank you all for being here.